Welcome back to the Tough Love Podcast with Dr. John O'Connor. Today's guest, Dr. Scott David, MD, HRT specialist, and expert in the topic of testosterone and male hormone replacement therapy. Doc, welcome to the podcast. So excited this podcast is a little bit outside of my realm with regards to doing more of a discovery educational podcast, but I loved your history, what brought you into this from the type of medicine you began your healthcare practice in. So first off, welcome to the show.
Thank you. Thank you.
Would you do me a huge favor and bring my audience into your story where you went from your initial phase of graduating medical school and going into practice and how you became the doctor you are today, please?
Yeah, so I went to medical school, went to residency, got board certified in emergency medicine, did that for a number of years, and actually was doing that up until last year part-time. I guess about 16, 18 years ago now, I had a sudden medical emergency myself. I had a brain aneurysm, needed emergency surgery. And following that, I survived. I did very well. My brain is still intact. And
good to know.
The neurosurgeon said I could even be smart enough to become a chiropractor if I wanted to be. But the problem was I felt horrible, and no one could figure it out. They tried me on antidepressants. All of that stuff didn't work. And I finally found somebody that tested my hormone levels. And sure enough, my testosterone and growth hormone were almost non-existent. We started therapy, and within weeks, I felt great. And I decided I needed to know a little bit more about this. So I went back and got board certified over a number of years. You kind of just did my own self teaching, but then I went and did formal teaching with the American Academy of Anti-Aging Medicine, which was the only real program back in the day, and I've been doing it ever since.
Excellent. Now, when you first began it, was it something that was readily accepted and available, or did it almost come across like witch doctory, if you will?
Yeah, I mean, there was definitely a lot of pushback from colleagues. A lot of guys were laughing, saying, "What are you doing?" Back then, it was basically, if you took testosterone, you were either doing bodybuilding, or if doctors were giving it to you, it was for some sort of endocrinologic disorder, pituitary disorder. And if you took it, you had a good chance of getting prostate cancer, was the thought. Just like estrogen in women, it was thought that it would cause breast cancer. Both of those things have been refuted greatly in multiple studies since.
Excellent. So that's a pretty amazing story. I mean, from a near-death experience where you could have been not practicing medicine anymore to do a 180 and kind of shift into what's now become mainstream. And so, if it wasn't for that personal trauma, you may have never touched this space.
Yeah, I don't think I would have. I mean, I think that, again, I was definitely, I guess I was pushed away from drinking the Kool-Aid, if you will. But the reality is the first time I went to an anti-aging conference, and it's got to be greater than 15 years ago, I walked in with the pre-thought that everyone there would be, six lawsuits and, just charlatans. And I was trying to find the education. And the keynote address came from the neurosurgeon who was the Pittsburgh Steelers lead physician. And they were talking about crazy things like Krebs cycle, and back then NAD and health, and that's like 16, 18 years ago. So Impressive. It was very interesting that it was so in depth, and it was real science.
Love to hear that. And so it's amazing. There's such a range of doctors in this space, and I'm sure you've seen that as well. What would you describe your practice? And I believe you're in Grand Cayman now, and you may do some stuff, here in the States. Mm-hmm. But what would the average patient, male or female, look like if you were bringing them in a normal profile?
Yeah, I mean, really, for me, I have patients in their 20s who may have either taken anabolic steroids and really screwed up their system, or they have a genetic disorder that no one else really has had the time to pick up, and they have low testosterone. And I have patients into my 80s. So it's really a variable
big range.
Yeah, but I guess the biggest thing and the most common complaint is, I just don't feel good. I'd like to feel better. And today, with the longevity and the regenerative, a lot of 30-year-olds, 40-year-olds are trying to be very proactive. I had a patient in the office the other day who was 35 years old, and he said, I'm reading Peter Attia and I'm listening to Huberman and I'm reading all of these headshot people that are on YouTube all the time. Is there any real science to it? And so it was kind of impressive to go through all the things, even with a young guy, but the reality is I like to look at it as 35 to 45 is what I call the dark zone, because you walk in, you see a doctor, and the first thing the doctor usually says is, boy, I wish I was 35 again. And they really don't pay attention to how you're feeling. And it's not right to testosterone, but it's a well variety of things. It's sort of a complex of way I look at patients.
I've been hearing a lot of people in this space, and the one thing about Huberman, these research doctors, is they're not practicing the space. They're researching and presenting data, which I think is interesting, right? So where you're actually if you will, a craftsman, you're in the space working out on the forefront, if you will, seeing cases and making changes in these people's lives. What's your thought on?
I'm sorry. No, I was saying that, Huberman is very good at presenting a lot of data. He's very good at presenting a lot of supplementation, and he's pushing the curve to clinical medicine, although he does tell everyone he's not a doctor. He's a PhD. He does teach in medical school, and he's a very educated and intelligent guy. And I like him. He's a likable guy. Peter Attia is kind of like becoming the forefront if he's not there already. He has a very expensive practice. He is a practicing physician. He was a surgeon at first, and he is more clinical, not clinical based, more evidence based. He's less of a clinician. I like to split doctors and physicians. Physicians is the kind of guy that, if you have a lesion in your brain, you want the guy to come in and you don't care about his personality. You want to he's a mechanic.
Execute and do the job well.
Yeah, a doctor's a guy that I consider myself to be a great doctor. I'll give you a hug if you need one. I'll kick you in the butt if you need one. And I'm able to talk to a CEO of a Fortune 500 company or a janitor. And that's the way I've always been. So yeah, it is a varied number of doctors. Some doctors are self-taught and they're just following protocols that might be outdated. Other doctors are putting the time in, whether they're going into the functional side of it or the endocrine side of it. But there's a wide range, and it is a subspecialty. It's not recognized. There's about 100 board certifications in America that are not recognized, like pediatric plastic surgery, things like this. They're just people put the time in, do a fellowship. Actually, one of the coolest fellowships right now that I just heard of, I think there's only 2 doctors in the country, is athletic cardiology. So it's guys like you who are, 50 years old, pushing it to the limit. But then you say one day, maybe you pop your chest like, I have chest pain. Well, if you go to a cardiologist, a regular guy on the street, he's going to look at you and go, you're fine. Maybe they'll do a stress test, But this guy actually specializes in athletic cardiology, which is
it's smart. It's needed.
Totally new fellowship. Yeah.
I had a guest on a podcast earlier, and I was blown away. They did 4 different types of scans that are the routine ones for breast cancer, and missed 4 times.
Yeah,
she was super concerned as a patient because they found it, they could feel it, but they couldn't identify it until they got in there, and then literally the opposite breast came back positive for cancer. And, hearing that story, I think it's like anything else, right? It's amazing to see the different levels. Now, if she didn't say anything, they could have just taken off the left breast and, who knows if she would have survived. Now she's a survivor of breast cancer 5 years later because she pushed the envelope. I think it's something to be said about it. I think these subcategories that are being created are much needed, because here's the other thing. With this anti-aging space, what's happening? At 50, I'm in the best shape I've been in the last 20 years, right? But my musculoskeletal system may not be cooperating to my muscles, if you will, and then my heart may not be cooperating. So there needs to be that genre, because I think that if you go to the general primary care physician, I think you're exactly right. I think they're going to say, you look fantastic, your body fat's 4%, and give you a quick pat on the butt and say, keep up the good work.
Yeah, and I think you have to look at it on a multiple different levels. I kind of use four facets to kind of paint the picture to patients when they come in. One is mobility. even a guy like you who's lifting, how mobile are you? Are you able to do a goblet squat? Are you able to lay on the ground and get up sort of, without using your hands, just pop up, right? And 70% of 70-year-olds in North America can't get off the floor without assistance. And I don't mean like holding on to something. I mean like somebody handing them something and saying, hey, I'll help you up. So mobility is something that is very, very keen. And most doctors are not, hey, touch your toes, do a goblet squat, that type of thing. Other thing is balance. Balance is something that no matter what kind of shape you're in, get on a Bosu ball or the cup ball, stand on one leg and see how good you are. Now you're really good, close your eyes. And again, these little subtle things that can, find little tracks in the spine that are kind of obscured for whether it's arthritis, whether it's spinal stenosis, things like that. Power is becoming in the present social media. Everybody's talking about muscle mass and protein intake, but power really is. I mean, from an endocrine system, from a life system, the more muscle mass, the more lean muscle mass you have, the chances are you're going to make it to beyond average expected life expectancy. And that's kind of a little play too. The last thing I talk about is mental health, not only emotional and psychological, but also what is your senior moments happening? How much mild cognitive impairment you have. I do neurocognitive testing in the office, which just gives us a baseline to see, does the patient have early signs of dementia? The test that I use can pick up signs as early as 10 years before they're symptomatic. Then we could do genetic testing and maybe MRIs and things like that. But one of the things that's interesting is that a good phrase to look at this longevity space is the average age in America of men dying is 75. That's average. Women make it to 77, average. But like you just said, you're 50 years old, you're above average, at least physically, right? So in the preventative space, if you make sure neurologically, cardiology, make sure things are that the obvious top 10 reasons you're going to die are either suppressed or not there, that really can add to longevity. So preventative medicine, in my experience, is really key.
I like that. I like that answer. And I think that's that whole functional thing versus there's well doctors and sick doctors.
Oh, yeah. Yeah, right? There's dis-ease and disease and things like that.
So I think that I love doctors taking this approach. But again, here's the other thing is the patient has to pay for it.
Yeah. Right. I mean, the best investment is yourself, right? Health is wealth. Agreed. But the reality is there are a lot of doctors out there that are just selling a bag of goods. They're marking up vitamins at 500%. They're making their own vitamins. All these things like that just don't make sense. But patients are grasping in the dark sometimes, and it's really important to me to be ethical along the way.
I like that. And it should be that way, right? And you should be practicing good, clean medicine. So, sure. Yeah. All right. So tell me this: what I think obviously the 50-year-old male, you went at that 30 to 40 range. But it's the truth. I've been intrigued by a lot of these studies with the recent downswing and a lot of younger males testing super low with their testosterone levels.
Right.
And it's quite interesting. What do you think the take is on that?
I think probably multiple reasons. One is we're looking, right? I think back in the Mad Men days, if there were all these tough macho guys, if you watched the Mad Men show back in the day. But the reality is nobody ever tested testosterone levels. So I think we're looking a lot more and we're looking a lot earlier. There are definitely epigenetic factors, meaning that, something in the environment. I often tell people, because I'm down on the island, if you take water bottles and you put them on the boat and you stick them in this 106-degree container and they come here and they're cooking and they come and they sit on the shelf and then they get in your trunk and it's 95 degrees and it's cooking and then you put them in the refrigerator, it's leaching, phytonutrients. BPA is the plastic one, right? And it's a xenoestrogen, excuse me. And that basically acts like estrogen. If you have a lot of estrogen in your body, men will stop making testosterone. The two sources are fat and external sources like BPA. So that's a big source of it. And then, you had the whole Roundup thing, was that causing the decrease in testosterone? But I think, looking and trying to see what the optimal number is. And I even think that today we're starting to see the changes in the optimal number. There was a recent study that just came out that we're not giving women enough testosterone. Most of the Quest or LabCorp kind of keeps them at a high end of about 60. Mm-hmm. But most of the studies are saying we really should probably be pushing that to 180.
Wow. Almost triple.
And there's some longevity studies. And again, I think as long as you don't have side effects, acne, oily skin, hair loss, deepening of your voice, etc., my patients tolerate it very well. If a woman is active, lifting, and is willing, and I do it in a very teamwork approach, if someone is willing to go higher levels, and I don't see any side effects, there's only positives to it. So it really does make a lot of sense. But, the thing is, when we were looking at, death rates, those people are average. And again, there's going to be a lot of people that suffer from, cancers and stress and mental issues where suicide still brings that number down quite a bit. But I have patients in their 80s that are still very, very healthy, go to the gym 5 days a week. They're on Cialis or Viagra, but they're still sexually active into their 80s.
Love it.
Yeah.
So the other thing that I thought was pretty intriguing is the balance. I will say, and I'd love to hear your experience with it being in the game for 15 years now. I've done both, right? So 2 years ago, or almost 3 years ago now, I was doing a combination of HRT replacement and peptides, and I was extremely, vascular and lean, but I wasn't gaining weight, and I wasn't recovering well. When I put the nutritional component in, where now I'm, eating a ton of, organic food, fruits, vegetables, and vitamins and supplementing, I can't believe that 1-2 punch. So is that something you feel should be within the practice of a HRT center, really stressing that?
Yeah, absolutely. I think that peptides. So peptides, again, the FDA had a major problem with peptides, primarily because Big Pharma has licensed all the popular ones. So you'll see them all again, BPC 157, which was not outlawed, but taken off the market, and Tesamorelin, Ipamorelin. Semarellin's still there because I'm not a real big fan of Semarelin. But the top 17 were removed. And Big Pharma is going to come back, and you're going to find BPC as being an injectable for arthritis or pain, probably. As far as nutrition goes, I'm a big believer. I've been a vegetable-based diet for 18 years, and I haven't had meat in probably 20 years. And so I think that the optimal diet is still up in the air. I'm not quite sure what
I know they're going back and forth at it right now. It's amazing,
Yeah, we'll go back to carb loading, and pizza and Italian food will be good again. And the reality
My
is,
mom would be happy.
So these things are gonna flip flop. The reality is they've tried to come up with what is the number one diet for longevity, and that is caloric restriction, which is really, really hard to do. And the gentleman that did that study, I met at a national conference, and he was older by that point, and he said, if you eat 800 calories a day, statistically, you're going to do very, very well. Now, there are some things like, intermittent fasting, rapamycin. Resveratrol just got knocked off the podium a little bit because a study just came out that showed it really wasn't all that. But anything that stimulates caloric restriction makes you live a little longer. And a lot of it comes from, cold plunge, sauna, steam bath, that's suffering. Our bodies are meant to kind of go through a little bit of suffering, whether it's working out or what have you. But the nutrients are very, very important. And again, most of the American diet is absolute poison. I worked in New Orleans. And you want to talk about some deliciously bad food, that's the place to go.
Horrible for you, right? Yeah. So terrible. Very interesting. And, one of the things that I thought was intriguing is during that time, and where my podcast started, Tough Love, was about the fact that I was coming out of a bout of depression, right? I got hurt, and it was really more injury-based, right? My entire life was based around being a professional athlete, training professional athletes, rehabbing them in all of our clinics, et cetera. And I wasn't eating. And the funny thing about it is, you're right, my blood work came back pristine, They're like, oh, there's nothing wrong with you. Like when you said you had your thing, you're like, I'm like, I don't know. I'm depressed. I'm skinny. Everything hurts. We got to do better because this can't be the answer. Because if there's nothing wrong with me, then I would like to be sick. Please make me sick so I feel better.
Right.
Yeah,
I mean, and women. I mean, women come to me all the time with sudden bouts of joint pain and body aches. And again, the most common sort of poetic complaint that women give me when they are complaining of perimenopause and menopause is they said someone came in the middle of the night, chopped off my head and put it on this body. This is not my body. And I don't know what's going on. Something's not right. But you get fogginess. And again, thyroid disease is a big thing, and especially in the perimenopausal space. But with physicians, with men, I don't know where I slipped up that one, but with men, if testosterone is low, you can get all of those symptoms. And, low testosterone, it makes you feel timid. And when there's something called the ADAM Symptom Survey Score, and it basically is 10 or 15 questions that will tell you whether you're, based on just this, and it's a vetted little questionnaire, whether you're insufficient, and that's a key word. You may not be deficient. The doctor says, oh, your testosterone's fine. You're under that 250 to 1250 rainbow, but you're insufficient for you. I've had patients that
I believe in that
come in with low testosterone levels. I've corrected them and they felt miserable, completely miserable. And you say, wow, how could that happen? Well, the reality is that you go back and do a more detailed study and you find out they didn't start shaving until they almost graduated college. So they've always had low testosterone. So now they come to me.
It's an abnormal normal.
I come from 300 and I bring them up to 900. They feel terrible. They're like, I can't handle this. This is not good. So it's very, very individualized. But the depression, there's a phrase with men on that symptom survey score, which women don't get. It's called inner unrest. And when I say that to a guy, say, are you experiencing like an inner unrest? It's not midlife crisis. It's just this disconnect that we feel society's not equaling where I think I'm supposed to be. Women, I've never had answer that question.
Relate to that, yeah.
Yeah, they're like, whether it's because of a nurturing aspect where they're just accepting it. But men are just like, no, I get that. And they could be, again, CEO of a company or a janitor. They're like, that's
they
exactly
relate to that question. Yeah,
that ticks off the box. My elevator pitch is somebody says, hey, what do you do? Longevity medicine, hormone optimization, blah, blah, blah. And they say, oh, okay, what's that all about? And I say, listen, if you look in the mirror, are you starting to see your father? You need to come see me. That's the way you're starting to age more than you want to.
Yeah, 100%. I agree with that. It's amazing because, again, I share with anybody. They come up and obviously, I look different than your average 50-year-old when I'm sitting there working out. And, one of the things that's intriguing to me is, I always like to light a candle. Like if someone asks, I'm like, I could check all the boxes of, any of these questionnaires you go through. And when you're the person that's running multiple practices, as you well know, being there, and then all of a sudden I'm lethargic, I'm detached, I'm not fired up. I think that, you got to look deeper. And it wasn't cancer. It wasn't this, wasn't that. I think my body went under a stressful load for an extended period of time. And it just threw all my physiological levels way off. And once we got it normalized, I was, that's why I was so excited to have you on today, because I think it's a huge need. I think there's so many people out there that are reaching for straws that don't really know what's going on. They don't even think to look down this healthcare vertical, if you will.
Yeah. And then, from the internal mental health part, that is a big deal. I mean, I like Jordan Peterson's, one of his phrases, which is one of my favorites, is, every man should be a complete savage under control. And that savagery or that masculinity is derived from testosterone. And the reality is that, you can continue to do well. You can continue to feel good. And 50 is just the entrance to the game. I got 9 years on you, and the reality is that's the key, keeping it going. And a lot of guys will just trail off. And I have patients in my practice from day one, 15, 16 years they've been with me. And, they're all in their 60s, and some guys are pushing 70, and the women too. And they've just
look and feel amazing.
Yeah, they look and feel. And the big thing is they are amazing. I mean, when we run them through whole body MRIs, like through Prenuvo, we'll do, extensive cancer screenings, like the Gallery test. We'll do all of these tests, and they're clean. And that's where you go back to the average. They're not average.
They're not the average.
They're not
75.
Yeah, they're not the superpower, but they've put their time in. They've used good gas. They've changed their spark plugs, and you got a nice, 1940s Porsche. It's still running.
I've used that in my practice for 20 plus years. I always say, I'm like, if you have a Ferrari, you can't put regular gas in it. A Ferrari or God forbid a Bugatti. I mean, my God, you're spending more on maintenance, but people will spend a fortune if their dog is not feeling well. They'll take care of that puppy. But I'm blown away with it, and this is we'll close on that for our first I'm sure of many podcasts. But that's probably the biggest thing when I dove into the coaching space was educating patients, or really their consumers, to put a more value on being able to look in the mirror and the person that's looking back on them. And and some people are just okay with it. They don't want to eat well. They don't want to. They don't care what they look like physically, but so many do. I don't know how many times I see people and I'll catch them looking off a reflection, pulling on their head or lifting themselves up or fixing this or tightening that or pulling this. And I'm laughing and I'm like, the doctor of modern day is going to say, how do you feel? Do you like what you're looking at when you look in the mirror? Do you enjoy yourself? And most people, I'd be curious to see what the answer is. I think a lot of people say, yeah, that's a good question. I never thought about it. Yeah, and really, that's how we approach our coaching, and I think it's a huge thing to say, listen, I would love to see you answer those questions without any hesitation or trepidation, to be like, you know what, Doc, great question. Here's my answer. I love myself. I invest a ton in my body. I take great care of myself and those around me. And I think that in that becomes not only the best patient receiving care, but it makes our job a lot easier when that patient wants to receive that type of care. But I think it's the education process. I think that's why I love what the diagnostics you were talking about earlier. It's like, if you could take those diagnostics to show them, hey, listen, if I told you I can show you a pathway where you are here and bring you to here, would you be interested? And, then kind of budget, I was talking about this with a plastic surgeon the other day that I'm actually about to do a podcast on, and she was so impressive. She actually tells her patients that if you don't plan on being a patient with, and her resume is ridiculous, for a lifetime, unless it's she does a lot of corrective work on bad work. She's like, I'm not the doctor for you. And I was like, you don't want that person in your practice? She goes, not really. I've made all the money I ever need to make. To be honest with you, I want someone to grow old with me, and that I understand their vision and I make their vision come true. Mm-hmm. But if they're bouncing around, it's like going to different theme parks. What you think is the best ride is not going to be what someone else thinks. And if I'm going to help them create that vision, I want to do it from the first step and the last step of the process. And I think that's something that, when I hear you talk, you have that same visionary concept. You talk about patients you've had for almost, 2 decades. I think it's impressive. So, the one thing I would say about today's discussion, which I thoroughly enjoyed, is, one last question. Doc, what would be you've been through it, right? Obviously a brain aneurysm, you survived it. That could have been a life-threatening situation. What do you think would be your quote that was on the wall of every clinic you're involved in? And they said, oh, Dr. Scott, he's this. What would that be? Or even better, what you would want to be perceived as?
I guess professionally, just more, like I said, the difference between the physician and a doctor. Someone that actually, becomes, part of the community, part of the patient's life. If they're, a lot of times, patients will run to their lawyer or their priest or their rabbi. And years ago, you used to also go ask the doctor for his or her advice, and maybe the lawyer for his or her advice. but I like to be part of their life, and I try to put myself in there, and for outside, it's I try to be, a good father and husband, and been doing that for a long time. So I think that's going okay.
That's excellent. Love to hear it. Well, listen, thank you so much for joining us today on the Tough Love Podcast. I think you had some extremely valuable information. I'm looking forward to replaying this one and hearing it again and learning from you.
Cool.
Anyway, to all my listeners, thank you so much. And Dr. Scott David, an absolute expert in his field of hormone replacement therapy and anti-aging. If you enjoyed this podcast today, please, like it, share it, and we look forward to seeing you guys again. Thank you and God bless.